Hi, everybody. My name is Renza Shibilia, and thank you for joining us for another one of our Facebook Live conversations. It's Kidney Health Week, so today we're talking about all things kidney. But before we do that, I'd like to say that I am joining you all today from beautiful Wurundjeri land, and I would like to acknowledge the traditional owners of this land and also pay respects to their elders, past, present, and emerging. Now, today I am joined by Amanda Aylward, who is joining us today from Kidney Health. Amanda, hello. Thank you so much
Hello,
for joining
Renza.
us. Tell us a little bit about yourself.
Well, I'm a credentialled diabetes educator and I'm presently working with Kidney Health Australia on their helpline as a health information officer. And I also work as part of the Northern Health Heart Program.
You're super busy. Now, Amanda and I had a lovely catch up because we have known each other forever, it seems,
Yes.
in the diabetes space. So I'm so excited to be having this chat with you. Although I can say we have never spoken about kidney health before. We spoke about diabetes and pregnancy, and you were around when I had a little baby and you had a little baby, and our babies are now teenagers and not little anymore. But today we're talking all about kidney health because this is so important for people living with diabetes. So let's start. I'm going to ask you, what's kidney disease? We hear about kidney disease, but what does that mean exactly?
It refers to all the conditions of kidneys that affect the filtration and removal of waste from the blood for 3 months or more. So your kidneys play a vital role in your body. They work hard to clean your blood and create urine for you 24 hours a day. Without kidney function, you would struggle to process toxins and eliminate waste. And this would have a devastating impact on your general health.
Okay, so are there really clear symptoms to kidney health, to kidney disease? What should we be looking for?
Well, in the early stages, you will feel normal. There is absolutely no obvious signs until you lose 90% of your kidney functions. And that's when the symptoms might appear. And that's why it's really, really important to take a kidney health check. So early detection is vital.
Okay. Now, as I say every week when we're doing these talks, please do ask us questions. We know that there are people watching via our Facebook page, and we've got Amanda here to answer those questions that you might have. So please just type them in the comments and we will get to them. If you would like to ask us a question or make a comment anonymously, you can, where I won't, say who's asking the question, you can send us a message through Messenger on Facebook, and we can share your comment anonymously there.
So can I just say that some of the symptoms to look out for, Renza, is like high blood pressure.
Okay.
Because you might feel dizzy or seem wobbly and you might have increased headaches, altered or blurred vision. Also look for changes in the amount of urine or the colour of the urine as well. If it's frothy, if it's dark in colour, it might mean blood.
Okay.
And also look for things like puffiness in your legs, ankles, or around your eyes.
Okay.
And if any of those occur, to go to your GP.
Yeah. Now, when you say frequency of urination, is it that you would be needing to go to the toilet more frequently or less frequently that you should be thinking?
Less frequently, in small amounts.
Okay.
Yes.
All right. Definitely go get it checked out. Always.
Yes. But look at the color of the urine as well. So when you're hydrated, it's much clearer.
Yes.
And when you're dehydrated, it's much darker. So, always look at, how much you're drinking as well, because that could be why it's a different color.
Of course. So what actually causes kidney disease to develop? How does it start?
There's a number of risk factors that can lead to kidney disease, and these include diabetes. So high levels of sugar in your blood can damage your organs, including your kidneys. But this is where, there's a blood test called a HbA1c.
Yep.
And everyone with diabetes should be aware of that test. And this is a test that the doctors do. And if you it shows the glucose attached to the red blood cells and shows the average over the 3 months. So ideally that should be around 7% or under. So the younger you are, the lower it should be. And the more you keep it down there, the less likely you have any risk of kidney disease. So the higher that HbA1c is, the more likely you're going to have some damage.
Okay. Yep.
And especially over the duration of the length of time you have diabetes as well.
Of course. Yeah, absolutely.
So the other risk factor is hypertension.
Okay.
So it's common for people with chronic kidney disease to have high blood pressure. High blood pressure puts strain on your heart and all of your blood vessels, including your kidneys.
Yeah.
Another risk factor is if you've ever had a stroke, heart attack, or been told you've got some heart failure. So we know that cardiovascular disease is a broad term that includes heart failure, heart attack, abnormal heart rhythms, heart valve problems, and stroke.
Mm-hmm.
Cardiovascular disease can cause kidney disease, and people with kidney disease are also at risk of cardiovascular disease. It goes both ways.
Okay. Yep. Yep.
Another risk factor is having a family history of kidney disease or kidney failure. This is because kidney disease can be genetic, such as polycystic kidneys or Alport syndrome, where these diseases are inherited from your family. Another risk factor is being overweight or having a body mass index of greater than 30, depending on your height. Because if you're overweight, your kidneys have to work harder and they have to filter more blood than normal to meet your body's increased demands. The damage from this can lead to kidney disease.
Okay. So there are lots of things to think about, right?
Yes, yes. And also about if you're, if you smoked or a current smoker. So people who smoke have 3 times more likely risk of developing kidney function. So smoking damages your blood vessels, including those ones in the kidneys.
Okay.
So by stopping smoking can really improve your kidney function.
Gee, we hear it all the time when we're talking about different diabetes complications. It's
yeah. And also to realize, there's a risk when you're older. So anyone over the 60 years of age has a higher risk of some kidney dysfunction, and that's just part of aging, the process.
Yeah.
And as you get older, things don't work as well. And also people who've experienced an acute kidney injury. So that's a short-term injury to the kidneys that happens due to a serious illness or kidney stones or sporting injury, and that leads to a risk of developing chronic kidney disease later in life.
Oh, okay.
And also people of Aboriginal and Torres Strait Islanders have a higher risk of developing kidney disease due to their genetic makeup.
Are there any other cultural groups that may have a higher risk?
Well, generally there's a higher risk in the Indian Southeast Asian population as well.
Yeah.
Because it's very high. Diabetes is very high in that area as well.
So this is why I guess we talk about, modifiable and non-modifiable risks. So these non-modifiable risk factors, things that, we can't do anything about how old we are or our background, all of these sorts of things. But understanding that means that that we may be at a higher risk means that these are questions that we should be asking when we're sitting in front of a health professional is, hey, because I know that I may be at an increased risk, should I or can I please have a check for this right now? So let's focus on the diabetes side of things, because we know most of the people watching will certainly be interested in that. And I wanted to ask about, so we did touch on this a little bit, but let's maybe go over it again. So why does living with diabetes increase a person's risk of developing kidney disease?
Because high levels of sugar in your blood damages your organs, including your kidney, as well as damaging your kidneys. It can damage your nerves and other parts of your bodies. So when your bladder is affected, it may be difficult for you to pass urine, and if your urine builds up in your bladder, the pressure can flow back into the kidneys, causing some scarring and damage.
Right. Okay.
And it damages the little filters that filter the waste products.
Okay. We've just had a question from Kylie. She says, should we be getting our HbA1c checked every 3 months? Now, obviously, this is going to be different for different people. So, as ever, this is a question for you to go back to your healthcare professional about and ask. But what's your advice here, or what would you suggest broadly? What should people be thinking about doing?
Yeah, well, if you're in the early stages and you have good control, it should be yearly.
Okay.
And depending on your health professional, your doctor or your specialist, and depending on how you're going, that may increase up to 6 monthly to 3 monthly, depending on what the level of your HbA1c is.
And type of diabetes. I know that in a lot of type 1 diabetes clinics, they're routinely done, people are going every 3
Yeah,
or
well,
4
when you have type 1, it might be more frequently, like every 6 months.
Yep. Okay. Terrific. Thank you. Okay. So we've just spoken about HbA1c checks, but now let's talk about kidney checks. How do we get our kidneys checked? How frequently should we be doing it? What does it involve?
So to have a kidney test check, you will need to go to your GP, and a kidney check involves a blood test to see how well your kidneys are filtering. So looking at your estimated glomerular filtration rate.
Okay.
A urine test to check for albumin, which is a type of protein, to see if you've got any blood in your urine as well.
Mm-hmm.
And the third thing is a blood pressure test, because high blood pressure and kidney disease are related.
Yep. So
yeah.
I was just going to say, we'll come back, we'll talk about it a little bit more in a minute, but kidney checks have changed, right? Because I remember I've had diabetes now it's 23 years nearly. And I'm pretty sure I used to have to do like a 24 or 48-hour urine collection as my annual kidney check. That's not now routine, is it? It's changed from that.
Well, it depends on your doctor, but if your test shows positive signs of kidney disease, your doctor will repeat the test to make sure.
Okay.
Your doctor may also organise an ultrasound to see the size and shape of your kidney, look for stone cysts or other problems.
Right.
And that's where they may do a 24-hour urine collection as well.
Yeah.
And in some instances, you may be referred to a kidney specialist, or a nephrologist is another name for that. A diagnosis of chronic kidney disease is only given when a positive test results are consistent for up to 3 months or more.
Okay. Yep.
And in this case, you will need to see a doctor for regular checkups.
Okay. All right. But I think that the really important thing to note is that it's part of a routine health check for people. It's a blood test. It's a urine sample, urine collection, and blood pressure check. So it's nothing really dramatic or really major that you need to set any major time aside for, is it? It's something that
no.
Yeah.
And the only painful bit about it is the having some blood taken.
Yeah.
Everything else is painful.
Good. All right. Now, so let's talk about frequency of kidney checks. Let's start with somebody who, so I have mine done every year, and I'm, touch wood, comes back with a no kidney disease detected little message on my pathology results. So I have mine done annually as part of my annual diabetes screening. What is that normal, or when would it not be only every year? When would it be more frequently?
Well, there's 5 stages of kidney disease. So, and usually if you're in the early stages of kidney, like 1 or 2, then you would only have your kidneys checked every 12 months.
Okay.
But if you're in the middle stages of kidney disease, which is around 50% function, you may need to have it 3 to 6 monthly. And it depends on what other factors are, contributing to your health as well.
Okay.
And then if you're in the stages of 4 or 5, then you may need to have a kidney check every 1 to 3 months.
Right. So these are obviously conversations to be having with your health team. Yeah.
Yes.
Yeah, absolutely. Now, one of the things that we, are always focused on when it comes to diabetes is risk, reducing our risk. We want to reduce our risk of developing type 2 diabetes in the first place where possible. And then when we're diagnosed with diabetes, reducing the risk of complications. And one of those complications, obviously, is kidney disease. So let's talk about what we can do to reduce those risks. What is, I guess, within, things that we can do on a day-to-day basis to reduce the risk of kidney disease?
I think one of the most important thing is to eat a healthy diet, including vegetables, fruits, whole grain cereals, lean meat, nuts and seeds, and low-fat dairy products. On our website, Kidney Health Australia website, there is actually a fact sheet on nutrition and kidney disease, which and other fact sheets are about drinking water as well, reducing your salt and sugar. Avoiding processed food and packaged food as much as possible, and avoiding a lot of takeaway food, limiting that. Being active, So trying to do at least 2 and 5 hours of moderate intensive physical activity each week, like a brisk walk, bike riding, swimming, dancing, social, tennis, golf, even doing housework
Mhm.
can count as an activity because you are physically active, or gardening, walking the dog, all help in maintaining good glucose control, but also will help your kidneys filter as well.
Yep.
And also help towards a healthy body weight, which is also a goal, and reducing a risk towards kidney disease. So if you have trouble losing your weight, you can always see accredited practicing dietitian, and you can speak to your GP or your specialist to get a referral to a
Yep.
dietitian. And there's also the Dietitians Association Australia,
Okay.
which you can contact their website as well.
Great. Now, I know that you're not a dietitian, but I do know that when people are diagnosed with kidney disease, there may be some modifications to their diet. Is that right?
Yes.
Yeah.
So it's about, reducing the salt
Okay.
and the potassium, low potassium, but it depends on what stage of kidney disease you have.
Okay.
And it's best to speak to a dietitian, but generally they don't recommend seeing a renal dietitian unless you're in the stages 4.
Okay.
And before that, you can have a look at our fact sheets on our website, just for general nutritional information about that.
But I guess that general advice that you're giving about reducing the risk is what we would say to anybody anywhere in the community,
Yes.
And we say it sometimes as it's a throwaway thing, eat better, eat more healthy, fresh foods and vegetables, eat less packaged food, go for a walk. And everybody has that same advice to remain as healthy as possible, but it is tough. So
I know.
it is tough, right? And if it wasn't, we would all be these super fit, super healthy, living on kale. Not really, but
I know.
like just that thing. But it's tough.
I think it's important for people to realize it's not a special diet. It's a diet that we
Yeah.
all need to do to keep
Yeah.
healthy. And it is hard because of advertising
Yeah.
and the abundance of takeaway foods and media and advertising and fast
Absolutely.
food outlets. It's much harder, definitely.
Yeah.
So that's why I'm saying, don't beat yourself up if you do have some takeaways. It's just all in moderation.
Of course.
So,
Absolutely.
and the other thing is to, like limit your alcohol intake if you drink alcohol, give up smoking if you can, and, monitoring your blood pressure, make sure that's right, and monitoring your blood sugars, that they're within target as much as possible, that your doctor has advised, or your diabetes educator.
Yeah, but I do love that, don't beat yourself up. It is really tough to be, superhuman healthy all the time. No one's doing it. Or very few people, really.
No, you can't.
But do what you
can't
can.
all be perfect, So.
No, I know that. And there's no such thing as a perfect person with diabetes. It doesn't work that way.
No.
All right. Okay. So we've sort of spoken about diabetes in very general terms here, but are people with all types of diabetes at risk of kidney disease, or is it only certain types of diabetes, or is it all types that need to be thinking about this?
No, I think it's all types need to be thinking of this, because, anyone with elevated blood glucose levels is at risk. And that's where we talk about the HbA1c, which is a test, which looks at the glucose, and you can talk to your specialist or your endocrinologist or your GP or your diabetes educator about that. And just keep an eye on that and make sure that is moving towards the lower end, so around 7%. And it also depends on the duration of diabetes. So how long you've had the diabetes, it puts you at a higher risk the longer you have diabetes.
Yes.
But again, if you keep yourself well and you keep in contact with your endocrinologist, diabetes educator, and maintain all that, it's good. What we do know that every second person who visits their doctor with diabetes will have some form of kidney disease.
Right. Okay.
So, and to know that you can, improve that, or, prevent it from getting worse by looking after your health.
Yep. So let's just talk about that for a minute. You said, so if you're diagnosed with some kidney disease, can that be reversed? Does that mean you have kidney disease forever, or does it mean actually if we follow these instructions and a health plan that hopefully is manageable to follow, that the next time we have a kidney check, actually we may not be seeing the same levels that we saw last time?
Yeah, well, when you're diagnosed with kidney disease, it's not going to change. You will have kidney disease, but
Okay.
you can control the level of it, the stages. So it can improve a little bit, but you do have chronic kidney disease. It doesn't change. It's like having type 2 diabetes. When it's well controlled, it seems like you don't have diabetes, but it's still there. So the moment you put on weight or you get sick, it might appear again,
Right.
and your sugar levels go up. So similar thing to that.
Okay. Yeah. Now we have a question that I am just actually going to not handle to you, but because somebody's actually asked, at what level, if you have pre-diabetes, should you not go on treatment yet? That's really individualized. Go and have a chat with your GP. If you've been diagnosed with pre-diabetes and are wondering what happens next and what you can do, definitely have a chat with your GP, because that's going to be different for everybody. Some people might need certain treatment before other people. So
so when they got pre-diabetes, they usually have, just need to go and have another check with their doctor after 6 months to see how there's, keep in touch with their GP.
Absolutely. Good. If there are any more questions, please do send them this way, because we haven't got much longer for this chat. So you want to get in quickly. Okay, let's talk about treatment for kidney disease. We hear about dialysis. What is it? When does somebody need to go on dialysis, and what does it mean?
So dialysis is one of the options for managing kidney failure. So when your kidneys get down to under 15%, it's something that your kidney specialist will talk to you about. So dialysis filters out the toxins, waste, and extra fluid that your kidneys would normally do. So when your kidneys are down to about 50% function, they're not doing that. So it doesn't replace your kidneys, nor does it return your kidneys' functions to normal. However, it does help improve your health and help continue for you to live even after your kidneys have failed.
Okay.
So there's two types of dialysis: hemodialysis and there's peritoneal dialysis.
Okay. Can you tell us about the two of them?
Yeah. So hemodialysis is where the needles are used to access your blood, and it's usually with a fistula in your arm, or it is a fistula in your arm, and blood is taken via tubing through a special filter which cleans your blood, and then it's returned cleaned into your body.
Okay.
And that can be 3 times a week, and it means that you need to sit in a chair for that time.
Okay.
There's also, you can do home dialysis as well. So you can do that at home and have it set up at your home. Then there's peritoneal dialysis, which works inside your body using the peritoneal membrane, which is the membrane around all your abdomen organs.
Okay.
And that's used to filter the blood. So the peritoneal dialysis is performed every day at home, either during the day or using manual bags at night, which is also using a machine.
Right. Okay. One of the questions I wanted to also ask was that you mentioned earlier on, but let's maybe go into a bit more detail about the different types of kidney disease. Can you tell us, it's not just one thing, is it? When we say kidney disease, you said that there are different types. So can you talk to us about those?
Yes. So there's two main types. There's acute kidney. So two main types of kidney disease are the short term, which is acute kidney injury, and then there's the lifelong kidney disease, which is a chronic kidney disease. So most people recover fully from short-term kidney disease, but it can increase the risk of developing chronic kidney disease later in life. Acute kidney injury is the temporary loss of kidney function lasting less than 3 months. It typically has a fast onset in response to an injury or illness affecting the kidney, such as drugs or blockages to the kidney or many other factors. Some people will need to have a short-term dialysis treatment to help their kidneys recover sometimes.
Okay.
Whereas chronic kidney disease occurs when your kidneys have been damaged in a way that cannot be reversed.
Right.
To be diagnosed with chronic kidney disease, the condition has to be present for at least 3 months.
Right. Okay.
So if you're shown on one test that you have, that doesn't mean you have it, chronic kidney disease. It needs to be followed up with another test.
All right. Right.
With 3 months later.
Okay. All right. Thank you. That's really useful, because I think we just sort of think it's just this one thing, and being able to actually understand the different types is really important. So what are some of the biggest myths and misconceptions about kidney disease and diabetes? What have you got for us?
Well, one of them is that if you have kidney disease, you will feel sick or notice symptoms.
Okay.
Now, often kidney disease is asymptomatic. In fact, you can function up until 10% of your kidney function. So what I'm trying to say is it's not uncommon to lose about 90% of your kidney function before you notice any symptoms.
Okay.
So many people won't feel sick in the early stages of kidney disease, and that's why it's really important to have a kidney check with your GP.
So this sounds like type 2 diabetes, where we
I know. So the same thing.
Undiagnosed. Yeah.
Exactly.
Okay.
So it's a silent disease. So like type 2 diabetes, you don't feel sick because your sugars are a little bit higher. And it's not until you've got some impairment in your eye or recurrent thrush or something like that, then it's picked up. So again, this is why going to the doctor to have a check of your glucose, your kidneys once a year is really important.
And that's right. So, we talk about, making sure that we're conscious of what's going on with our health. This is one of the things to ask. I think that most people realize that they might need to have their cholesterol checked every year and have their blood pressure checked, but specifically ask, are you checking my kidneys? I think that's, that's perfectly reasonable. And chances are it's probably happening. It's probably one of the things on the pathology slip, but ask. And I also think it's really important for people to ask about, are there changes? So, is this the same as it was last year, or is this something that I should be concerned about? Asking those questions is really important.
Exactly, Renza. That's correct. Yeah. Another myth is that my estimated glomerular filtration rate looks fine. Therefore, I don't have kidney disease.
Right. Explain that. That's words that I don't know what they mean.
So, estimated glomerular filtration rate is the filtration of urine through your kidneys. So it's possible to have a normal estimated glomerular filtration rate, which is a blood test for the kidney function, and still have kidney disease. And this is why it's important to make sure you have your urine tested as well. Because if you show high level of protein, that shows that there's some form of kidney disease there.
Okay, right. Okay. Yep. So 2 things to be thinking about and to be asking about then. All right.
And that's why you need to have all those tests done.
Yep.
The urine, the blood, and the blood pressure.
Yes. And so that's another thing for people to think about, is when you have your annual screening check and you're given a pathology slip, make sure that you need to do a urine sample as well, not just the blood, have blood taken. All right, good. Yes. All right. There's a lot to think about here. What else have we got?
Sometimes some people think if I have kidney disease, I will end up on dialysis.
Yes.
So if kidney disease is picked up early and managed well with medication and lifestyle changes, it is possible to reduce your progression of disease as much as 50%.
Wow. Okay.
So there is a good chance that you'll be able to live dialysis free for some time. One of the key challenges for people with kidney disease and diabetes is that both conditions put you at high risk of cardiovascular event, such as a heart attack. So it's really important to detect these conditions early and have regular checks with your GP.
Okay. So early detection, early treatment, constant theme in healthcare, things to remember, and also to not think about things in isolation. So it's not just diabetes, just kidney, just cardiovascular. Look at it as a big picture thing. So blood pressure check as well as HbA1c check. So blood pressure check, HbA1c check, and kidney check. And then you're getting the full picture. Is that
Yes,
good?
that's
All right.
correct.
That's what we want people to take away from today.
Yes.
All right.
And one more myth
Yes.
I've got here. So I have chronic kidney disease and diabetes.
Yep.
Do I need to see a kidney specialist?
Yes. Good question.
Yes. So people with kidney disease and diabetes can be managed by a primary care setting and only need to see a specialist once their kidney disease has progressed to stage 4 or 5.
Oh, okay.
In general, people with an estimated glomerular filtration rate less than 30 and it's rapidly declining, or significant protein in their urine or uncontrolled blood pressure need to see a specialist.
Right.
Other people can just be managed successfully with their GP.
Okay. There has been so much information here. Thank you so much. Now, we have more information about diabetes and kidney health at the Diabetes Australia website, and I know that Emily will share some of that information in the comments, as well as a link to Kidney Health Australia, so that people can can read all the information they need, and then ask any questions about yourself to your health professional when you are next seeing them. Asking questions is never, ever a bad thing. And I know that I often go in with my list of questions, and in my mind, I'm thinking these are such silly questions. There's never anything, there's no such thing as a silly question. So please have a look at those websites and take in a list of questions. I think that's really important. But have you got anything else that you want to add to this, Amanda? You have been so wonderful. It's been so good to chat. But what else have you got there?
Well, I just want to say to people that we do have a kidney risk test on our website.
Good. Okay. Yep.
So you just have to put in www.kidney.org.au/kidney risk test.
Okay.
And then that takes them straight to it.
Wonderful.
Or they can call the helpline, which is 1-800-454-363.
Fantastic.
If they have any questions.
We'll make sure that we put those details in the comments so people can just click on the link directly. So thank you so much, Amanda.
Thank you, Renza, for having me.
Oh, it's been so lovely having you to talk about this, and I really enjoyed our little catch up beforehand as well. It's always nice.
Thank you.
Those of us who have been in this diabetes space for so long, it's nice to catch up. Now, everybody, this chat will remain on our Facebook page. Please watch it again, because there is a lot of information in here. If there's anything that you wanted to double check, forward it on to anyone who you think may be interested or may benefit from it. But it will remain on our Facebook page and also be on our YouTube channel as well, and on our Twitter, and probably on our Instagram, because we just go everywhere these days, because we want to get this message out. Early detection, early treatment. It's
exactly. That's what we need to do. Check our kidneys.
Check our kidneys. Absolutely. Part of your screening.
And check our sugar as well.
And check the HbA1c. Very good. Thank you so much, Amanda.
Thank you, Renza.
Thanks, Em. Let's end.
Bye.
Bye.